Good morning, everyone. My name is Au Wing Sze. Have a look at this picture. Seems familiar, right? It will always appear on TV during flu season. However, it appears on TV more often nowadays due to the increasing demand of A&E service. So today, I would like to explore what can be done to solve the problem of long waiting time of A&E service in Hong Kong public hospital. So let's look at the situation first. In 2023 to 2024, over 2 million people were admitted to the public A&E service department each year. And I argue that the most effective solution is to introducing the public-private partnership to solve the problem at its root. And I will first analyze the main cause and consequence of the problem, then discuss two possible solutions and their feasibility, and conclude with the most effective one. So the main cause of the long waiting time is the misallocation of the medical resource. And many patients they opt for public A&E service because they think it is more accessible and more affordable. However, this will lead to a serious consequence, which is the overload of the public sector and also the underutilization of the private sector. And we can see from this data, the private hospital bed occupancy rate has decreased from 62% in 2019 to 47% in 2022. In contrast, the public hospital bed occupancy rate has remained persistently high at around 80%. So this will lead to a serious consequence, which is the deterioration of the health condition of patients, the increased mortality rate, and also the inefficiency of the public healthcare system. Therefore, I would like to introduce the first solution, which is the compulsory social insurance. It mandates the employee and employer to contribute to the scheme, and also the government will provide some subsidy to non-worker and elderly. And the key advantage is that it reduces the cost barrier and also it reduces the patient on the reliance on the public A&E service. And it has successfully implemented in mainland for over 50 years, and which cover over 1.33 billion of people by 2025, which account for over 95% of the whole China population. However, it also faces some long-term sustainability risks due to the aging population. And Hong Kong also faces a similar problem, and Hong Kong is a place with the longest lifespan and the lowest fertility rate. And this scheme requires continuing physical injection, and it is very costly. It requires the younger generation to continue to give money to support this scheme, so it may create some burden on the younger generation, which is an unsustainable approach. Therefore, I would like to introduce a more sustainable approach, which is the public-private partnership. It is a scheme that the public ambulance they can divert some semi-emergency and emergency patients to the private hospital, and the government will provide some subsidized follow-up treatment. And the benefit is that first, reduce waiting time, because it's diverting people into different sectors of hospital, and second, enhance experience. Patient can receive a better treatment at the same cost. And last, resource optimization. Because the doctor in different sectors, they can share their skills and share their expertise, so it can enhance their experience also. And for the implementation part, first, the semi-emergent and emergent patient should be prioritized to private medical sector. And second, the government will provide subsidy covering 50 to 70% for the eligible private hospital fees. And also, seamless healthcare records should be shared between the private and public sector. And to conclude, the long waiting time of A&E service at public hospital is a serious issue nowadays. And we hope that by introducing the public-private partnership, we can reduce the waiting time at public hospital and also increase the service quality and increase the efficiency of the whole medical system. Thank you.
Ask for questions. Ask for questions. Ask for questions.
Do you have any questions?
in what ways are Hong Kong similar up to the Singapore one in terms of the medical problem, and in what ways would the Hong Kong needs adjustment to change PVP a little bit to suit the case in Hong Kong?
Thank you for your question. And I think that we can use Singapore's approach as a core mechanism and make some little adjustment based on local situation. And for the similar part, we can see that the demographic composition of Hong Kong and there is some unused medical resource in both Singapore and Hong Kong. So these are similar parts. So I think we can just directly use the approach that diverts some semi-emergent patient and some emergent patient to the private sector, and this is the similar one. And for the ELTU adjustment is that there is some difference in the healthcare system. For example, the pricing strategy and the price sensitivity of the local patient. So we may need to adjust a little bit. And I think it is important for the government to provide some support and some coordination because the private-public partnership have not implemented in Hong Kong before. And also the government should set a clear subsidy system. Thank you.
Thank you, Lily, for your well-structured presentation. And you explained that compulsory social insurance based on long-term risks from population aging, while public-private partnership is more sustainable. So my question is, if PPP relies on private sector willingness to participate, how can government motivate private hospital to cooperate when treating subsidized patients may lower their profit margin? Thank you.
Thank you for your question. So I think to increase the motivation for the private hospital to join these schemes is that the government can offer some incentives. For example, the government can first set a fixed price for each treatment, and to ensure that each hospital join, they can earn a reasonable profit, and also they can also provide some tax reduction so the private hospitals can also benefit from it. And last, I think they can also provide some public recognition for the private hospital because this can make the private hospital benefit because the private hospital can increase its brand reputation and brand image. And I think that by doing so, we hope the private hospital they can actively join, but instead of forcing them to do so.